Hi everyone, it's Andrew Terry again, just going through a little bit of a small sequence of videos here about the various powders that can be utilised with the various Combi Pro 2, which I call the jewel in the crown of the NSK periodontal management and oral hygiene equipment that they offer to their clients. So with this next kind of powder I'm going to talk about, it's called the soft powder. So this powder is basically a glycine powder, which is an amino acid. It's 65 microns. The technique with this particular powder is generally where you're roughly about 3 to about 10 millimeters from the actual tooth surface, because it has a bit of a peripheral spray. And the angulation recommendation is roughly 30 to 90 degrees actually parallel to the tooth surface. And particularly when you're a bit further away from the tooth, that's where that spray can go. So with this powder and also with the pearl powder, this is where we don't want this going on to soft tissues ideally. With the soft powder, if some peripheral spray gets onto the gingiva, that's fine. We're generally moving quite quickly. As we've mentioned before, generally I like to disclose my patients first with plaque disclosing agent, then give them oral hygiene instruction. Then after that, move on to air powder polishing straight away. So then we're going to remove that residual air powder, that residual stained biofilm with the air powder polishing. So this is where, as I said, that particular technique around 30 to 90 degrees, this particular powder is fine for on restorative material. We don't tend to have it, as I said, on soft tissues, so keep it away from the gingival margin, around orthodontic abutments, zirconia fillings as well, around abutments is okay, but this is where it's a bit of a softer powder as the name implies, so therefore it won't damage any sort of technically very glossy and really well done composites. It's perfectly safe to use. In terms of the stain scale that I was mentioning in the previous video, this is where I might take the lateral surface of a sickle just to test a stained area to see how easily it may come away with the lateral surface of a sickle. And if it's around the 7, 6, 5, 4 mark, in that sort of regard, with 10 being the most amount of stain, 1 being barely any stain at all, maybe just some stained biofilm, that's where I'll tend to look for this particular powder and use that powder in a separate chamber. It can be used in the same chamber as what your pearl powder can be, but I found it more convenient to actually obtain a separate attachment powder and basically network with the line to then actually just quickly swap that in and out so that when I want to change over those powders, I can easily do that. So that's generally my approach here in clinic. So let's show you a little demonstration video there now with that angulation, that 30 to 90 degrees, and then basically around that sort of 3 to 10 millimeter distance from the tooth surface. So let's have a look at that video now.